Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Accidents happen, but when injuries occur, sometimes it makes sense to use insurance other than your medical coverage. Joining me today is Shawn Stack, a policy director at the Healthcare Financial Management Association. Shawn, you and I have talked about health insurance a number of times and how to navigate that process, but liability insurance is a whole different process. How does that work?
Yes, Erica. So there's general liability insurance, for instance, insurance that covers falls or injuries that occur on someone else's property or a business. This type of insurance typically covers immediate medical cost for injuries that occurred based on the location and the insurance policy covering where the incident occurred. And then, of course, many times automobile insurance is involved as the liability insurance. And in that case, the most common coverage is referred to as personal injury protection or MedPay auto policy. That insurance is intended to pay medical bills for you or your passengers, regardless of fault. Auto medical coverage usually has caps like $5,000 or $10,000. So serious injuries often shift costs to health insurance, but that auto insurance is there. And fault does matter in auto insurance. So if another driver is at fault, their liability coverage may reimburse your medical expenses, but that process takes time and may require legal action.
So in the case of an injury at work, workers' compensation comes into play. Is that considered liability insurance? And if so, how does that process differ?
Good question, Erica. And workers' compensation is certainly a very common coverage seen in hospitals and at providers and at primary physician offices. Always the key question to ask a patient is your reason for seeking care today as a result of a work-related injury? And if you're a patient, make certain that you tell your doctor that this is a work-related complication. That gives a prompt to the provider that workers' compensation coverage may be involved and that they need to flag that visit or that service as workers' compensation. The reason you want to do that is you want to make certain that the medical service is flagged as being workers' comp at the time of the first and any related follow-up visits. It's extremely important as it can directly tie to any benefits for lost wages due to time off for the related injury and potential short-term or long-term disability documentation.
Liability claims can take years to resolve, which could mean you're getting a bill from a provider that you're not actually responsible for. How do you handle that situation?
Let me break this down for you, Erica. So you wanna be proactive and transparent. Let the provider or the hospital know your care is related to an accident and the liability claim is in progress. Give them your auto insurance or your health insurance information or your workers' comp information for your employer. Ask about billing practices. Clarify whether they bill your health insurance first or wait for that liability claim to be initiated. This avoids surprise bills. And then request written statements. Ask the provider to note that the charges are connected to a liability case and may not ultimately be your responsibility. And then stay in touch. Check in periodically with the billing office so your account doesn't slip into collections while the legal process or the liability process unfolds, keeping them updated on that process. And then, of course, as always, document everything. Keep copies of bills, insurance communications, and claim numbers. This helps resolve any disputes later.
Does your health insurance factor into liability claims at all?
Absolutely, it does, and it depends on what state you're in. So hospitals and insurers work together to sort which policy pays, but delays and denials are common points of patient frustration. I would recommend, again, checking in frequently to ensure everything is on the correct path in the following up of payment or any disputes that may occur due to a liability claim. With all liability coverages, it is important to make certain that the medical issue is coded appropriately and reported to the liability coverage for concise and accurate coverage of all care related to that accident, either whether it's immediate care or ongoing care that you require. But keep in mind that in some states, auto insurance pays first, and in others, your health insurance is billed first and auto covers what's left. So know those details and confirm billing practices with that hospital or medical provider going into the situation.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.